This video is about lower extremity lymphedema in breast cancer patients. LymphedemaPumpsDirect.com. Call us today at 855-361-2944. Lymphatic system disorders or complications are common in many different patients, not the least of which are the elderly, or those who are suffering or have suffered from different types of cancer. The most common disorder of the lymph system is lymphedema, which is a condition where the lymph fluid builds up in the interstitial cellular space. Some of the most common reasons for lymphedema are cancers of the lower portion of the body, including pelvic cancers as well as various cancer treatments themselves. Other things that can cause lymphedema are even more subtle, including things like bug bites, sunburns, and even other illnesses which can on occasion cause lymphedema. One of the most common causes of lower extremity lymphedema in breast cancer patients is damage to the lymphatic system or lymphectomy, which interrupts the processes of lymph drainage. The extent of lower extremity lymphedema can vary from very serious to a milder form. In all cases, the treatments will begin more conservatively and may become considerably more aggressive in response to the severity or the lack of response to other treatments. Once you have been diagnosed with lymphedema, one of the best choices you can make is to visit a licensed lymphedema specialist who can advise you on the best methods to accomplish a return to a more normal state of your lower extremities. Lymph fluid actually comes from your plasma. The plasma enters into your capillaries and is deposited in the interstitial spaces. Some of the plasma then becomes lymph fluid and is carried away by the lymph system. When the system is compromised, for example when breast cancer or breast cancer treatment has taken place, lower extremity lymphedema in breast cancer patients can be very common, but may also be very damaging to the person who is suffering from it. The fluid builds up and may cause some very heavy swelling, even to the point where movement is restricted and the patient feels unwell and uncomfortable. This high level of fluid may in many cases be alleviated by the use of a lymphedema pump, which will assist in moving the extra fluid around the body and consequently help you to reduce some of the swelling that is associated with that fluid. When the lymphedema pump is used, the fluids are forced to move through the lymph system and may be expelled from the body. In many cases, lymphedema pumps are routinely used for treatment after breast cancer surgery in order to not only promote good drainage but to relieve swelling after it has already taken place. Your physician can order the lymphedema pump for you, and in many cases your insurance will cover the cost of the pump and the treatments which take place at your home. Lymphedema pumps are easily learned and your treatments can take place in the privacy of your own home. If you're suffering from lymphedema from breast cancer surgery, speak with your physician to see if a lymphedema pump may be right for you. Dramatically improve the quality of your life and successful management of your condition with our lymphedema pump. We'll work with your doctor and insurance provider for you. Call us today at 855-361-2944 or visit LymphedemaPumpsDirect.com.